So talk about a very important aspect of pharmacology that kind of like links up with reproductive physiology and obstetrics. We'll talk about the pharmacology of male sexual hormones and also female sexual hormones. Then we'll also talk about the application of contraceptives. That's like how contraceptives come in and they are actually being useful. So for what we got here, just so you know, that the male sexual hormones are what is known as the androgens. Okay, so the main ones are the testosterone produced from the testes and the adrenal gland. So they help in the development of male reproductive organs. Okay, also formation of sexual characteristics like deep voice, muscle mass, having hair, libido, formation of sperm. You get. So pharmacology, we have testosterone preparations. Those ones, they give it to anybody that's having low levels of testosterone. Do you understand? So adverse effects, they can cause excessive pimples, liver dysfunction, they can cause infertility. Sometimes if it gets too much of everything is bad, right? So moving forward, so that for the female hormones, we have the estrogens. Examples, we have the estradiol, we have the ethinyl estradiol. So they help in the development of female reproductive organs, okay, secondary sexual characteristics, and menstrual cycle regulation. Okay, so they can be used to replace hormones in a female that is actually lacking those estrogens, using treating menstrual disorders. Okay, all of that. So adverse effects, they can cause breast tenderness, nausea, thromboembolism, increased risks of breast cancer, increased risks of endometrial cancers, and all of that. So progestins, we have examples like the progesterone, the medroxy progesterone, and the levonorgestrel. So these ones are still under female hormones. So these ones, they usually come in when there's like pregnancy, so they prepare the endometrium for implantation, and throughout the pregnancy, they are the ones that usually make that the pregnancy is sustained. Okay, so if you give it to a woman that is not pregnant, it will trick the body to feel as if it is pregnant, and there will be no pregnancies coming in. I don't know if you understand. So they are used as contraceptives and all of that. But when you're giving it to someone, there's a side effect of weight gains, mood changes, irregular bleedings, and all of that. So contraceptives now are basically things that you give it to prevent, not really give, can be used to, hormonal ones are given, while the non-hormonal ones are just use it, So the hormonal contraceptives, we can combine estrogen and progestin. So they'll just they'll make it that the woman will not menstruate. You understand? So there will be no pregnancies coming up. We have the progestin contraceptives like the Depo-Provera. We have implants, the etonogestrel. We have the intrauterine device like the levonorgestrel. So they thicken the cervical mucus. They suppress ovulation, okay, variably. So all types of other non-hormone contraceptives, hormone and non-hormone contraceptives. Okay, this can pause to observe. So other ones have emergency contraceptions like the high dose levonorgestrel. So for the non-hormonal ones, you have lots of condoms, diaphragms, intrauterine device, sterilization, where they can cut the fallopian tube or cut the spermatic cord just to stop the egg or the sperm from coming down for fertilization.